Hello doctors, welcome back. Welcome back to the PSM part of Dr. Sasi's Gamechanger session. Fine. In this, we'll discuss about the PSM part. We'll take up the total is around like more than 1 hours. So PSM it will be having this more than 30 to 35 questions, and out of which like half or more than half will be from this PD because it is very much high yielding. So don't miss it out. Okay, that is my point. Okay, we'll continue with this. Fine. Okay, we'll start with the PSM part. In PSM, as I told you, it will be from 30 to 35 questions it will be asked from this PSM point, and out of which you will get 10 questions in each sessions. It will be new. Okay, they will change the trend of this PSM in each time with new sets of questions, but the rest 20 questions it will be always fixed. Okay, and it will be from this topic, so you will get around 20 to 25 questions of your PSM from this note. Okay, that will be based on my experience what I have. Okay, first we'll see about this epidemiological study. Okay, what they will ask you in epidemiological study is that which of the following study which is used to assess the incidence. So remember, in the case of cohort study, we can measure the incidence, because if you see the cohort study, it is of different types: prospective cohort and retrospective cohort. In the case of cohort study, what we'll do, we'll start from the risk factor, means whether the smoking is present or not. Like he's smoker, he's a non-smoker, and we'll travel in time and we'll check for the effect. Like what are the effects it is causing, or is it causing this lung cancer or not? Okay, this is the proper cohort study. Whereas you evaluated for one disease, you have this prospective cohort already. Now you can go retrospectively, like yeah, he had this exposure. Okay, now he had this exposure, and now you are associating with another factor. Okay, another factor. Okay, that is what, or another disease. That is this retrospective cohort study. And with this cohort study, we know we can identify incidence. Incidence means number of new cases. That is the number of new cases. Okay, and with this incidence, we can tell what is the relative risk, attributable risk, and population attributable risk. Like what is the risk that you have between a normal person who is not smoking to the smoking person, and how you will affect in this community, and how it will affect in this overall population. So you will tell all of this with this cohort study, and this will be done. Yeah, it will be from today to this future. Today from 2024 to this 2026 November. Then it will be the unit will be what? It will be this unit of the study. In a case of cohort, it is the individual. And next, what can happen is that it is 2024. Like you passed your FMGE examinations, you are out of stress. You thought okay, stress तो निकल गया, तो चलो सुट्टा पीना छोड़ देते हैं. So you will leave this habit, or you will leave this study designs itself, or leave for the study itself. So it is known as attrition bias, also known as last to follow up. It is known as last to follow up. Okay, and here we'll be able to see, we can tell about this natural history of disease. We can tell here about this natural history of disease, and also we can tell what is the association between this risk factor to the disease. And next one, it is the case control study. This case control study, it is what? It is a retrospective study. In the case of case control study, you have the disease present. The disease is already present. While having this patient itself, you are having the disease, like, and you will be having a normal control. You will ask him whether you got a lung cancer patient, and you ask him whether did you smoke before. So you are asking questions to him. You are taking history from him. So it is what? It is this case control study. Okay, we are going from disease to the risk factor, or from the effect to the cause, and it measures nothing. It measures one thing, which is known as what? Which is known as odds ratio. Odds ratio, it will tell you this association. If odds ratio is equal to 0, okay, then there is no association. If it is more than 1, then we'll call it as there is the positive, there is a relation. Okay, there is a relation with it. If it is less than, actually there is no relation. Okay, the unit of study here, it is the individual. And what the patient can have is that when you ask questions to him, or when you ask history to him, the patients may forget. This is known as recall bias. So recall bias you will see in a case of case control disease. Yeah, and this usually done in backward directions, and especially for the rare diseases. Okay, for any rare pancreatic cancer. So in such cases, you will use this case control study. And next it is the cross-sectional study. Okay, now after this class, you went for the lunch. Okay, you went for a biryani center in the Saket, or you went for a biryani center in the Gautam Nagar. Okay, उसके आसपास क्या होगा? मतलब चाय की दुकान होगा, टपरी होगा, तो there they will be having the smokers. And now जैसे आपने खाना कर, means while you are having the lunch, आपको याद आया ठीक है आज तो हमने क्रॉस सेक्शन पढ़ा, तो चलो ठीक है उसका इस्तेमाल कर देते हैं. So you plan to work out like कितने लोग एक टाइम पे सुट्टा पी रहे हैं, ठीक है. So you are evaluating at the certain point of time, okay, at this moment how many of them they are smokers, okay. So it is like a kind of snapshot study. It is not a snapchat, it is snapshot study. It is also known as snapshot study at the present time, okay. And with this I can tell you this many इतने लोग यहाँ पे सुट्टा पी रहे हैं करके. So you can tell about this prevalence of this thing. So it will tell you about the prevalence. So cross sectional will tell you about the prevalence, and this also will be done in a case of individually. It will be done in individually. Next one, it is what it is, this ecological study. And this ecological study, they also known as correlational study, and it is just comparing the populations. Like then you means you passed FMGE, you clear the UPSC, and you became an officer. You became an officer come doctor. Okay, once you became an officer, means you got multiple cases of this लंग कैंसर. तब आपको पता चला ठीक है यार कि कितना सुट्टा फेंक मतलब बेच रहे हैं करके. then you were able to analyze how much cigarettes they are selling. So from that you got to know that how much this is occurring in the population. So you went to the government, you got the details or data of it. So if you are taking the data from the general publications or from the government and you are comparing it, so it is what it is, this ecological study. It is the ecological study. So it is what it is, the correlation of variables where we can measure using this ecological study. And with this ecological study, it will be done in population. It won't be done in individual level. It will be done in the population level. It will be done at the population level. It will be done at the whole population. ठीक है, whole population मतलब एक बंदा एक दिन में 3 सिगरेट पी रहा. So it is like that. But there will be few people, they won't even smoke. Okay, so there will be the few people. So it is the ecological studies. It won't be equally spread, but it will tell an average value. Okay, that's it. That's it. You need to know about this epidemiological study designs. They will tell in question, they will describe a patient is presented with lung cancer. So you want to evaluate the cause for this lung cancer. Now you have the patient and you choose a normal person as a control. Okay, you have the patient and normal person as a control. Which of the following study designs you will use to analyze the relation with it? तो आप क्या करोगे, कौन से स्टडी डिजाइन यूज करोगे where you have this patient or the diseased person and the normal person? या कौन से स्टडी डिजाइन यूज करोगे? You will use case control. You will use case control if there is a presence of disease. Okay, yeah, you will use case control if there is a presence of disease. Okay, then we'll move on to the next part, which is this. Yeah, next part, which is this levels of prevention. Levels of prevention mean nothing. You need to know whether the risk factor is present or not and the disease is present or not. ठीक है, अगर कोई risk factor बिल्कुल अभी तक आया नहीं है, means someone is telling, okay, well means in your small ages they are telling like जैसे आपके बचपन में थे, in your small age they are childhood they are telling like not to adapt bad habits. ठीक है, बस अब तुम्हें बोल रहे हैं कि bad habits नहीं develop नहीं करना. ठीक है, so it is what it is, the primordial prevention. ठीक है, because there is no risk factors present, whereas you became young or you became adolescent, then there is a risk factor of cardiovascular diseases because of your family and things present, and someone is telling try to exercise. So if there is presence of risk factor and you are doing some changes in it, that is the primary prevention. For example, in a case of COVID-19, you should wash the hands. Because of COVID-19 only, you are washing the hands. That is a risk factor is present. That's why you are doing some intervention. Okay. Whereas in the case of secondary prevention, okay, in secondary prevention, what you will do is that there is a risk factor, and because of this risk factor, there is a developed disease. For example, you had this lifestyle changes, very bad lifestyle. Because of that, you have developed hypertension. अगर आपको hypertension हो गया, then what you need to do is that you need to do yearly diagnosis and treatment. So you should do yearly diagnosis and treatment. So diagnosis or screening and treatment, it will be under this secondary prevention. It will be under the secondary prevention. Okay. Next about the tertiary prevention. Okay, there is risk factor is present, the disease also present, but complication is also present. For example, there is a RT occurred and there is this complications of unable to walk. Then now what you will do in the case of tertiary preventions to prevent from this further damaging, what you will do, you will remove the leg or you will give some aids. For example, wearing a chashma, wearing a specs for this ocular mobility, it will be a tertiary prevention for reducing its complications are not progressing into the disability. So it is what it is, the tertiary prevention. So in the case of primary prevention, how will you do prevention? आप बोलोगे उनको, will do health promotion and health education. Whereas primary prevention like diseases, they do exist. For example, vaccination, there is a risk. That's why we are doing what? That's why we are doing the vaccination. So like specific protection like vaccination. And here also health promotion like hand washing because of the presence of risk factor. Then in the case of secondary, the disease is present. So we need to make diagnosis. Make diagnosis and treatment. Fine. And in the case of tertiary prevention, the disease already is there, and because of this preventing complications and further disabilities, we are using what? We are using CHESMA. So it is what? It is a type of tertiary prevention. It is a type of tertiary prevention. Like for example, leprosy patients, giving them proper aid. So it is what? It is the preventing the tertiary complications, which is the tertiary mode of prevention, like disability limitation and rehabilitation. Okay, right. So these are the things you need to remember about the levels of prevention. फिर उसके बाद आगे बढ़ते demographic cycle. Vaccine is a primary prevention until unless it is given for a treatment. For example, in a case of superficial bladder cancer, we'll give TB vaccine for a treatment. Okay, that is a treatment, but usually we'll give vaccine for a prevention. Okay, that is the primary level. It is not primordial, it is the primary. So primordial, primary, secondary and tertiary. Okay, remember. Then we'll move on to the next part, which is this demographic cycle. This demographic cycle, if you see, the demographic cycle, they have love on it. They were keep on asking about this demographic cycle in all the examination, irrespective of NEET, PG, INSET and FMGE. And mostly it is present in all the examinations. So you should know in and out of this demographic cycle. Okay, if you see, initially it is known as what? High stationary phase, and there is early expanding, followed by this late expanding and low stationary and declining. India is in early, like India is in stage 3, which is this late expanding. So if you see in early stages, the both the birth rate and death rate, both of them will be more. The birth rate and death rate will be more in the case of stage 1, which is this high stationary, and followed by which will be starting this interventions to decrease the death. So the death rate will start decreasing. So in stage 2, the death rate will start decreasing, whereas this birth rate will remain high. Okay, will remain high. So there will be this variations between this birth rate and death rate. So this is known as what? This is known as demographic gap. And we'll see maximum demographic gap in a case of stage 2. We'll see in a case of stage 2, which is this early expanding. Whereas in a case of stage 3, if you're able to see, this birth rate, it also start decreasing. This is where in India, okay, there is already decreasing death rate, but the birth rate also started decreasing. Okay, the birth rate also will start decreasing. Once the birth rate start decreasing, this demographic gap, it will start decreasing. So here the demographic graph will start declining. Okay, here the death rate is already low, but the birth rate will be start decreasing. Okay, next, if you see the stage 4, followed by the stage 4, the birth rate will become very minimal and death rate will be around less, but around a stage level. So that way it is known as low stationary. First high stationary, early expanding, late expanding, then low stationary, and then decline. Okay, then decline. These are the stages you should know of. Fine. And if you see about this low stationary part, it is what? It is both death rate and birth rate will be less, but still the birth rate is more than the death rate. Okay, birth rate is more than the death rate. Remember, this is the one thing. Birth rate is more than the death rate. Okay, this is the low stationary phase. Fine. And followed by which the declining phase. In declining phase, the death rate will be low, whereas birth rate will be lower than the death rate. So this is the one catch point. Here the birth rate will be lower than the death rate. Here birth rate will be lower than the death rate. So they can give you this phase and they will ask you which phase is this. You should tell it is high stationary. Which phase is this? It is this late expanding. Which phase is this? It is the declining phase. And they will ask you in which of the following where there is a negative, means where is this negative gap, where there is this negative demographic gap. You should tell it is the stage 5, which is the declining phase. Stage 5, which is the declining phase. Yeah, that's it. You need to know about this demographic graph. You should see it once or twice before going to the examination, and there will be one solid questions from this. Okay, we'll move on to the next one. There are few parameters you should know about their content. Means what are these parameters? For example, HDI, which is this Human Developmental Index, and PQLI, Physical Quality Index of Life. Okay, or Physical Quality of Life Index. Okay, and both of them will be remembered by this mnemonic of LIL. Okay, LIL. LIL. So L stands for literacy rate. Okay, literacy rate. Then I for infant mortality rate. Literacy rate, infant mortality rate, and life expectancy in 1 year. Remember, how will you write this? PQLI. So this I is looking like a 1. This I is looking like a 1. So it is PQL1. So it is life expectancy at 1 year. Once kitna year? At 1 year. So life expectancy at 1 year. Next one is this human developmental index. This human developmental index, it ranges from 0 to 1, and it also has this LIL. So one is the same literacy rate. So instead of infant mortality rate, here it is the income, or this gross national income per capita. Okay, it is the gross national income per capita, fine, which amounts for our living standards. Then here also this life expectancy, but remember, this is the life expectancy at birth, whereas in the case of PQLI, it is the life expectancy at 1 year. It is the life expectancy at 1 year there. Here it is life expectancy at birth. Okay. Next one more scale. It is known as what? Kuppu-Swami scale. It is known as Kuppu-Swami scale. This Kuppu-Swami scale is used to tell whether the population is in which class, like upper class, upper middle class, or lower middle class, or lower class. Okay, based on their to define their socio-economic status. Okay, to decide their socio-economic status, and the score will be from minimum from 3 to 29. But what they will ask you, what are the components? See here, the component is education and occupation of head of the family. Education and occupation of the head of the family. And the next one, it is not the salary of the head of the family, it is the income per month from all the sources, from all the people. It is not the head of family, it is from all the people. So they will ask you income from only the head of family. That is a false statement. So you should be vigilant in these cases. Yeah. Okay. Next, about this few more things. If you see about this DALI, which is this disability adjusted life years, this what, which is this disability adjusted life years, it will be having this two components. Like this is what, this is with disability, how much life you have lived. Okay, years of lost means because of this premature death or something, how much year has been lost, or along with this years he lived with this disability. So this is known as was DALI, which is what, which is this disability adjusted life years. It will tell the burden of the disease in the community. So how much percentage of the people they are suffering, means how much people they are living with the disability, and how much yearly they are dying when compared to the normal population. This is known as disability adjusted life years. For example, if normal people is dying at 70 years, they will die at 50 years. This is the years of lost, whereas normal people, they will live without any problem until 50-60 years. Here they start their problems at 30 years. So this is the years lost, means 20 years are being lost than usual. So it will tell about this burden of the disease. Yeah, good, fine. Next, about the quality adjusted life years. About this quality adjusted life years, you need to know how much years, or after intervention, how much years has been increased. Increase in number of years or gain in number of years after an intervention. For example, you diagnose a case of hypertension or diabetes much early in your life, and because of your diagnosis, you took some intervention, you given them drugs, and because of this drugs and the medicines, the patient is living for more 10-15 years. So it is known as what? Quality adjusted life years. Fine. And next one, how much year he lived without any disability, or he lived without any disability or disease. For example, if the disease is started at 30, means till 30 years he was without any disease or disability. Okay, remember this thing. That is known as Sullivan's index. That is known as Sullivan's index. Fine. In recently they started asking about this formula. What are this formula? If you see, the most important differentiating formula is this maternal mortality rate and maternal mortality ratio. Fine. If you see about the rate, usually this numerator will be a part of the denominator, whereas ratio, it won't be a part of this denominator, won't be a part of, means that this numerator won't be a part of this denominator. So likewise, in the case of maternal mortality ratio, it is the number of maternal deaths per live birth. It is the number of maternal deaths per live births into constants 100,000, 10,000 lakh into 1 lakh population. It is 1 lakh population. So it is the number of maternal death per live births per 1 lakh populations. Whereas maternal mortality rate, it is what it is, this number of deaths in a woman in reproductive age, with what is the reproductive age? It is the 15 to 49, the same 1 lakh. Same 1 lakh. Same 1 lakh. So remember, it is maternal mortality ratio, it is number of per live birth. Okay, maternal deaths per live birth. Whereas here it is the woman in the reproductive age. You know, this woman in the reproductive age, they only will get pregnant, right? So the numerator, it is a part of denominator. So that is the maternal mortality rate. Fine. And in pediatrics, we need to know few formulas. One is this infant mortality rate. We know we'll call them as infant if they are within 1 year. And there are two. And there are few more. Okay. So to calculate this, it is what it is, number of infant deaths during the year divided by number of live births during the same year into 1000. Whereas there are this neonatal mortality rate. This neonatal mortality rate, it is of two types, yearly and late. Neonates are those peoples, are this child 0 to less than 28 days. Okay, 0 to 7 here or 7 to 28. So it is this, let me write clearly, yearly and late neonatal mortality rate. If you see, yearly means it is 0 to 7, whereas late it is what? It is 7 to 28 days. So usually neonates, they are the 0 to less than 28 days. Okay, these are them. So there are two more formula is there, just replace with yearly and late, you will get it. So here this number of infant deaths less than 29 days. Okay, less than 29 days during the year to this number of live births. So it is what it is, this neonatal mortality rate. Next one, it is what it is, the child death rate. Child death rate is number of death of children of 1 to 4 years during the year divided by mid-year population. Remember, it is the mid-year population between 1 to 4 years into 1000. So all of this mostly it will be 1000. Whereas maternal mortality ratio and rate, it will be having this 1 lakh formulas. Fine. Then this under 5 mortality rate. Under 5 means within 5 years, how many children have been died during this year. So this number of live births. Okay. So we will measure like neonates till 1 year, how much they are surviving, until under 5, how much they are surviving, and how many children they are usually surviving. So we'll check it. Okay. Yeah. The mid will calculate from the 1st July. Next one, it is the crude death rate. Means number of deaths divided by mid-year population into 1000. And case fatality rate means how much the patients are dying from the disease, or how much patients who are suffering from the similar disease are ended up in death. Okay, so number of death from a particular disease, okay, to this total number of cases of the same disease. It is the same disease into 100. Here it is 100 because we express them in percentage. So it is the 100. Fine. Next, we'll look into this instruments. If you see these instruments, these are most commonly used. So it is what? This is this kata thermometer, and this kata thermometer, it is used to measure the cooling power of the air, and it is used to measure the cooling power of the air, and also it can measure this low air velocity. It can measure the low air velocity and cooling power of the air. Next, if you see this image, it is this globe thermometer, means globe. So globe thermometer can pick the heat from anywhere. So it can pick the heat from anywhere. So it is what it is. It can pick the radiating heats. So it can pick the radiating heat. It is the globe thermometer. And then this is this sling type psychrometer. You will keep in hand and you will move like in a slingy motions. So it will tell the humidity of the air. Okay, there will be two thermometers. Okay, wet and dry. Okay, so it will be the sling psychrometer. It will tell the humidity of the air. Okay. Next, it is this Asman psychrometer, and it is also tell about the humidity of air. Fine. And next, if you see, this one will tell about this velocity or movement of the air, or what is the velocity of the air, it will be told by this anemometer, or will be measured by this anemometer. It is what it is, this anemometer. It is the anemometer. It is the anemometer. Fine. And next, we'll move on to this daily dosage. If you see first about this energy, it is calculated for this normal men and normal women. Who are calculated as normal men and women are ideal. So they should be within the age of 19 to 39, like you and me, and they should be having this BMI of 18.5 to 22.9. 18.5 to 22.9. And for men, it should be 65. Men should be more, right? So men should be 65 and females should be 55. So men should be 65 and females should be 55. Fine. And there are three levels: sedentary, moderate and heavy. If you see now, we are just sitting, reading, revising. We are giving work to our brain. So it will be mostly considered as sedentary. Whereas when you join your internship, like initially we'll think it is a moderate, but actually we'll do what? We'll do this heavy work. Okay, we will taking samples, sometimes taking the patient even, taking this instruments, taking this big files. So that is the heavy work. So for this, now you can eat less. Okay, you can become fat also, no issues, right? So to know now, it is this caloric requirement. So it is very easy. It is easy peasy for you. Remember, have a calculation of first. For sedentary, you should remember. For sedentary, you should remember. Fine. For sedentary, if you see, it is the 2100. Okay, it is 2100. And if you add around 600, okay, 600, it is what? It is the 2700. It is 2700. And next, if you add more 800 or more 700, it is what? It is around 3400. It is actually made it round. It is 3500. Okay, and this is the opposite of here. Here, if you see, initially for women, it is 1700 for a sedentary life, and the first and second for a male, 2100 and 2700. Okay, that's it. Okay, you need to remember 2100 and 1700. 2100 plus 600 कितना हुआ? 2700. 2700 plus 800 कितना हुआ? 3500. The same here. Just keep the same. 2500 first one, 2700 second one. Put it into this moderate and the heavy worker level. That's it. It will be remembering for you. Okay, it will remember for you. Then during the pregnancy, you should start giving this extra calories, like from 350 calories. Okay, you should start from 350 calories. In second trimester, it can go up to 400. Whereas during lactation, you should go from 600 plus 520 calories. 600 to plus 520 calories, like based on the time, like for example, initial 6 months, then later. Okay, remember. Then about the infants, for first 6 months, you should feed at least 550 calories. 550 calories, fine. And 670 calories for 6 to 12 months. For 550 for first are infants till 6 months, whereas for 670 for 6 to 2 months. 670 for 6 to 12 months. Just remember. Then about this RDA. In this, remember, this man will be having this around 20, like 20, 30, 40. So see, this man will be having around 19. So the ideal requirement in man, it is what? It is 20. Whereas woman, usually it is around 30, it is 29. So in pregnancy, it is bit more. So it is what? It is 40. Okay, it is pregnancy, it is 40. And in lactation, it is less. It is 24. It is 23 or 24. Next, around folic acid. For man, it is 300. For woman, it is 220. Whereas in pregnancy, it is more. It is 570. So that's why we'll give supplementation of folic acid during the pregnancy. Okay, that we'll see how much we'll give based on the age. We'll see in the anemia muktubara. Fine. Whereas during lactation, we'll give 330. Okay, 330. And rest of these conditions will use same calcium. Whereas for old age patients and on lactation, we'll give 1200 mg per day. Fine. Next, about vitamin A. For man, it is 8000. Woman, it is 840. Pregnancy, it is 900. And lactation will give more, that is 950. And the questions are being asked from the iodine part. Okay, the normal man and female, it is 150. 150. Whereas during pregnancy, it is 250. Whereas during lactation, it is 280. During lactation, the only or the main which is increased is, we know obviously calcium will be given more. Whereas iodine also will be given more, which is 280 during the lactations of the child. Fine. Then we'll move on to this adulteration. Fine. We'll move on to this adulteration. During this adulterance, if you see, this adulterance, first one, it is the neuroletharism. It is what? It is neuroletharism. This neuroletharism will be because of this flower. What is the name of this flower or this plant? It is what? It is this Lathyrus sativus. Okay, Lathyrus sativus. Yeah, which is having an adulterant component of this caseridon. Okay, this is the plant name of the plant. They will ask you. It is what? It is the Lathyrus sativus, and this will cause this neuroletharism. And in neuroletharism, they will hold this stick. They will hold this stick. So it will be staged as stick stages. Okay, and they'll be having this toxin which is known as BUA toxin, which is known as beta oxalyl aminoalanine. Beta oxalyl aminoalanine, which will be causing this neuroletharism. Okay, and it is due to because of adulterated caseridon. Fine. And next, how will you remove this? We can remove by adding this ascorbic acid, which is the vitamin C, or also by steeping and paraboiling or paraboiling it. Fine, yeah, good. To treat, we'll use this vitamin C. Next one, it is this endemic ascites. Endemic ascites, it is due to this pyrolysin derivatives of these plants, okay, of these plants. And it is actually what it is, this adulterated millets, and it can be removed by sieving. It will be removed by sieving. No, see, endemic ascites, it is the pyrrolidine, okay, pyrrolidine, okay, it is the millet spot. Whereas next we'll see there is epidemic drops, remember, drops. What will drop? What will drop? Water and oil will drop. ठीक है, water and oil. ठीक है ना, तुम्हें पता ना कि oil, ठीक है, water means पानी भी नीचे गिरेगा, तेल भी नीचे गिरेगा. So see, it is epidemic drop C. Drop C. It will be what water and also will fall, and oil also will drop. So see sanguinarine. Okay, narine. Okay, sanguinarine is what it is, looking like water, like other name of waters, right? Sanguinarine. Okay, narine. So remember, it is the water component. So water also will fall. So the toxin here, it is sanguinarine. Then it is adulterated in the case of with mustard oil. So mustard oil की जहाँ पे ये adulterated हो जाता है. Okay, so it is what it is, adulterated mustard oil. So हम कैसे करेंगे? इसको हम निकालेंगे. And this is the plant, okay, which is causing this epidemic dropsy. Can anyone tell me what is the name of this plant which causes this sanguinarine toxicity? This is being adulterated with this mustard oil, and it is what it is, this Argemone mexicana. Yellow oleander हमने देखा था. It is what it is, cardiac poison. Whereas here it is not like yellow oleander. You see here this stones like this there. It is what it is, this Argemone mexicana. It is the Argemone mexicana. Next you see this groundnuts which are being affected by this fungus. Groundnuts which are being affected by this fungus. It is what it is, this Aspergillus fungus. Aspergillus fungus, especially this Aspergillus flavus, which is causing this aspergillosis, and here it will be causing this aflatoxicosis by this aflatoxin. And this aflatoxicosis can be related to a tumor or a carcinoma. Which of the following tumor will be, cancer will be caused by this aflatoxin? Which of the following tumor will be caused by this consuming of this adulterated nuts, or this nuts with this aspergillus toxin or aflatoxin? Yeah, it is the hepatocellular carcinoma. It is the hepatocellular carcinoma. And mostly if this nuts which are being not dried properly, this will lead to this aspergillus formation. Okay, so what we need to do, we need to reduce the humidity and we need to improve the ventilation. हमने पता है जैसे where this improved ventilation, this ventilation carry out this moistures. ठीक है, इतना याद रखो. Next, this ergots. It's mostly seen in a case of this rice, sorghum and bajra plants. There this ergots will grow. Okay, where this ergots will grow like this. So it is what it is, this ergotism. And this ergotism, how will you differentiate? Usually this will sink, whereas this ergots, they will float in a, they will float. ठीक है, वो तैरेगा means like, ठीक है, so they will float in this 20% saturated solution. Okay, it will be 20% saturated solution में it will be floating. Fine, just remember ergotism. The first we'll start, it is the vectors. If you see about these vectors, the vectors we need to know, they are these mosquitoes, fleas, louse and ticks. And if you see about them, first we'll see about these mosquitoes. If you see this mosquito, which is this Anopheles mosquito. Anopheles, you cannot tell it is as just Anopheles. It is what? It is female Anopheles mosquito. It is what? It is the female Anopheles mosquito which is responsible for malaria. And we know females, they are what? They are angels. They are what? They are the angels. So remember, they are these angels, we know, as they are angels. And this is not small and simple angels. They are the sophisticated angels. Since they are the sophisticated angels, they will be having these wings. Angels will be having the wings, and these sophisticated angels will be having the special dots in their wings. That's why this Anopheles mosquito will be having a wings along with black spots on its wings. Okay, black spots on its wings. Okay, and it sits at an angle of 45 degrees. Okay, and we know the most of the girls, they will be clean in nature, and they will be always, or most of the time, if you ask whether you are single or committed, most of the time their answer will be they are single. So they will lay their eggs in a single forms, and they are angels which are having this special dots in them. Okay, and they are very sophisticated, and they cause what? And they will cause malaria. they will cause malaria. Remember, so it is the female Anopheles mosquito which is responsible for this malaria, and they will set it on degree of 45 degree. Then next we'll come to the Culex. If we see about this Culex, the Culex is also known as nuisance mosquito. Why it is known as nuisance mosquito? Because if you see, you know this hip hop singers, right? The rappers are hip hop singers are this rappers. Okay, if you see them, they will make the nuisance, like how in the way, like it won't be like a song, it will be a crowded people making a noise, and they will ask you why, what, like in Hindi they will ask kyun kyun kyun. So, and they won't sit like this straight, they will always having this thing, and they will ask. So see and remember that they will be sitting like this. So remember this Culex as they will ask Q. Okay, so remember it as Culex, and they won't be sitting straight, they will be having this hunchbacks. So it is known as hunchback appearance. Right? And we know this usual singers, they will come single and sing, whereas this rappers and this hip hop singers, they usually come in yeah, it is Q Q Q, and they will come in clusters or in groups. Okay, and their noise for some people it is like a nuisance. So remember, they come in clusters, or they lay eggs in clusters, and they will ask you Q Q. That's why they are the Culex, and they will be dirty most of the times. Remember, they will be dirty most of the times, and they will be sitting like this, and they will asking you. That's why they will be having this hunchback appearance. They will be having this hunchback appearance, and the disease which are being spread by the Culex, which include this lymphatic filariasis and Japanese encephalitis. Lymphatic filariasis and Japanese encephalitis. Fine. And next mosquito, it is this Aedes mosquito, also known as tiger mosquito. Okay, tiger. Tiger is a vegetarian or a non-vegetarian, guys? Is tiger is a vegetarian or non-vegetarian? Tiger, it is a non-vegetarian. So remember, to see this, to remember this mnemonics or this, to remember the disease which are being caused by the Aedes, remember it as dry chickens. Dry chickens. Okay, it is a non-veg. Yeah, good. It is a chicken. So remember, it is the disease which is being caused by this Aedes mosquito includes dengue fever, Rift Valley fever, dengue fever, Rift Valley fever, yellow fever, chikungunya, and Zika virus. Chikungunya and Zika virus. D for dengue, R for Rift Valley fever, Y for yellow fever, then chikungunya and Zika virus disease. So all of this following will be spread by this Aedes mosquito, which is known as tiger's mosquito. Okay, tiger's mosquito, and it will be having this tab. This will be having this stripes, like white and black stripes. It will be having this white and black stripes. And next one, it is what? It is this Mansonia. This Mansonia mosquito, it has a peculiar feature. It will lay their eggs in this Mansonia plants, which is actually what? Which is an aquatic plants. This Mansonia plants. So they given this name as Mansonia itself. And they will be having this long legs. They will be having this long legs when compared to the other mosquitoes. And they also lay eggs in clusters, but they lay eggs in star-shaped clusters. Yeah, they will lay eggs in star-shaped clusters, and it is responsible for causing this lymphatic filariasis. So lymphatic filariasis will be transmitted by two mosquitoes. One is this Mansonia. Next one is the Culex. Okay, remember. And next about this few more vectors. If you're able to see this head, if head is present, then it is what? Yeah, then it is what? Then it is the hard tick. Whereas if head is absent, then it is the soft tick. Okay, if head is absent, it is the soft tick. Where if head is present, it is what? It is the hard tick. Then you need to remember the disease which are being spread by this hard tick and soft tick. Okay, so remember this. First, remembering this disease which are being spread by this soft tick, remember this QRS. Okay, QRS. So soft tick will transmit this Q fever and relapsing fever. Q fever and relapsing fever will be transmitted by this soft. Next, this hard tick, all of this hard tick will be having this tick in their name. Remember, Indian tick typhus, tick encephalitis, and tick hemorrhagic fever. Okay, tick hemorrhagic fever, and some other diseases with their tick, like tularemia. Yeah, tularemia, and one more important disease. It is what? It is this Caesar forest disease. It is the Caesar forest diseases. It is the Caesar forest disease. Fine. And next, it is our favorite fun, which is actually our pet. Remember, it is our pet. Who is our pet? Like our louse. our lives, it is our pet because it is with us, right? We have a dog, cat, and one more pet, which is this louse. Fine. So remember them as pet. Our pet are pet. Okay, remember. So this louse include this pet. Tuberculosis, epidemic typus. It is epidemic. Okay, remember it as LEP. It is the epidemic typus and relapsing fever and trench fever. So these are the 4 diseases which are being spread by this louse. Spread by this louse. Yeah, good guys. Then if you see this next bug, it is what? It is this kissing bug which causes this disease, which is known as Chagas disease. Redweed bug, also kissing bug, which causes this Chagas disease. Can anyone tell me what is the name of the disease which call them as kissing disease? It is what? It is the infectious mononucleosis. It is the infectious mononucleosis, yeah. By this ABV, we'll call them as Kissing's disease. Okay, Kissing's disease. Kissing's disease. Next we see this fly. Okay, this is what? This is sand fly. Okay, sand fly. Okay, this sand fly actually having the wings, but it won't usually fly. It won't usually fly because there will be this attachment. There will be this attachment of the small hairy projections into their wings. So because of this, it won't fly. It will just hop. So remember, the sandfly will just hop. And the disease which is being spread by the sandfly include Kala-azar, oriental sore, and this Oraya fever. Yeah. And we know for this Kala-azar, we use antigen which is known as RK39 antigen. RK39 antigen. Then if you see this organism, this is what? This is what? This is this rat flea, also known as Xenopsilla, also known as Xenopsilla, which is responsible for this plague. Remember this flea, pen and lip. So flea will causes endemic typus. Flea will causes endemic typus, whereas louse will cause this epidemic typus. Epidemic typus. Different types of plague is there. Yeah, fine. And these are the vectors you need to remember of. Okay, just have a go through this ones, and you will be remembering this for lifetime. Fine. Next, about this pillars of this primary health. So if you see, there are few principles of this principles and pillars. First, we'll see about these principles. If you see about these principles, the principles include equitable distribution. Okay, equitable distribution and community participation and intersectoral coordination. Like for example, you are working in a PHC, it should be helped by this police station and by this municipal corporation. So all of these things will do this intersectoral coordination and using this appropriate technology where it is needed. For example, using this apparatus and using these methods for demonstration. So these are these 4 principles of primary health. 4 principles of primary healthcare. Fine. And we'll come to the numerical part where how much is the requirement for a PHC subcenter and rest mode. If you see from the subcenter wise, the subcenter, it is 1 per 5,000 in plains, whereas in hilly areas or tribal areas, it is 1 per 3,000 population. And mostly whoever will be there in subcenter, they are these health workers include this multi-purpose worker male and multi-purpose worker female. Okay, and usually there is number of beds which includes 0 to 3. In 0 to 3 in the sense was, if it is A, means which is where there is just to monitoring or just to rest, will have 0 or 1 bed. Whereas in type B, it is the better one. It is the better one which has this delivery option, which will be having the bed. So if you are allowing delivery in subcenter, there will be a bed should be available. So it is type B which is having this beds. Fine. And next about this PHC, if you see about this primary health center. So after subcenter, it is the primary health center. That actually the medical officer works. So in PHC, the medical officer will be, he won't be in subcenter. Fine. So it will be in usually in urban PHC, UPHC, it will be in for 5,000 population. Whereas in plains, it is for 30,000. Whereas in hilly areas, it is for every 20,000 population. And there will be this medical officer, health assistant, ANM, pharmacist, and a lab technician as well. Fine. Here, it is also based on this number of deliveries only. A, there will be a less number of deliveries. B, there will be more number of deliveries. That way, there is more number of beds in the case of type B type of PHCs. Fine. In the case of CHC, for the CHC, yeah, good Dr. Shanavas, yeah, good. In the case of CHC, we see it is 5 lakh 1 per CHC for metro cities, whereas 2.5 lakh for non-metro cities. For plains, it is 1,20,000, and in hilly areas, it is 80,000. Fine. and there will be the specialized doctors, OTs, technicians, and lab technicians will be there. So the beds will be in rurally it will be from 30 to 50, whereas in urban it is 50 to 100. Fine. And in district hospital it will be mostly now it is per district, and they converted them into this medical colleges as well. Fine. There should be this specialized doctors or super specialized doctors along with this blood banks. Fine. The minimum it is 100, where it is recommended it is what it is 1 per 1000. Okay. Just remember. And medical colleges, there is no any population norms that after this many it should be medical college. But now most of the CHCs are this district hospitals. Like after the district hospitals, they has been promoted to this medical colleges. Just remember that's only. Fine. Well, this will move on to this international part. If you see the first one, it is this World Health Organization. We'll see about this logos. This is the WHO logo, and the headquarters of this WHO, it is located at Geneva. Fine, it is located at Geneva. And next it is this United Nations International Children's Emergency Fund, and the head office it is at the New York. And it runs a campaign, which is known as Gobi Triple F campaign, and it is very important one, I will tell you. Then it runs one more thing which is known as baby friendly hospitals, okay, or baby friendly hospitals initiatives. Fine. Then this Danida, it is a Danish one, but it is in India, it helps in this blindness control program. Whereas SIDA, the Swedish one, it helps in the TB. The Swedish one, it will help in the TB part of India. Fine. As I told you, this Gobi Triple F, it is under this UNICEF, and this includes the Gobi, growth monitoring of the child, providing ORS to them, and breastfeeding them, and immunizing them, and also for 2 things which is necessary. What are they? They are this female education and family planning. So remember this, you will often get confusion with this F things like female education, family planning, and food supplementation. So female education, family planning, and food supplementations. These are the 3 things which stands for this triple F. Okay. Whereas G for growth monitoring, O for ORS, P for breastfeeding, and I for immunization. Yeah. Good guys, that you should remember of. Next about the type of vaccines. And this thing, if you see, this is known as ILR. This ice-slide refrigerators, they are kept at the level of subcenter. Is it true? Is they kept under or kept at subcenter level? No, they are not kept at the level of subcenter. They are kept at the level of PHC. Yeah. So they are kept at the level of PHC. And if you see them, there is a sequence we should keep. For example, initially, we on the top of it, this will be having this less temperature. There we need to place this freeze-sensitive vaccines. Fine. Whereas this hepatitis B, pentavalent, and IPV, okay, it should be the order. So pentavalent and hepatitis B, they are much freeze-sensitive. So we need to put them in upper lines, followed by this DPT, and in middle it should be TT. Okay, the TT should be in the middle of this freeze-sensitive and heat-sensitive vaccines. And the heat-sensitive one, the most one, it is this OPV, and we need to keep measles, then Japanese encephalitis and BCG, then finally the Rota. So OPV, measles, JE, BCG, and rotavirus. This is the sequence. That's how we need to keep, or how we need to line in this ice line refrigerator. Okay. So this is based on this freeze-sensitivity and heat sensitive. Fine. So how will you find like whether this vaccine is frozen or not, or undergo much degree of frozen or not? What is the name of the test you will use? We'll use a test which is known as shake test to know this freeze sensitivity, or this whether the vaccine has been frozen or not. Frozen. Like we'll use this shake test. Yeah, good, Dr. Hone. We'll use this shake test. Fine. And we have these few vaccines. They are this live vaccines, cold vaccines. These live vaccines include our BCG, varicella, MMR vaccine, then influenza, then rotavirus, JE, polio, and typhoid vaccine. Okay, all of the vaccines, they are what? They are this live vaccines. Whereas killed vaccines include TD and Tdap, which also they having this proteinous subunit, then killed influenza vaccine. Fine. And conjugate vaccines we usually develop from this capsules, like for example, pneumo PCV and meningococcal vaccine. Okay, both of them will develop from this capsule of this organisms. Fine. So these are the types of vaccines that you should know. Next, we'll move on to this one, which is this vaccine vial monitor. Okay, this is this vaccine vial monitor, and we know the outer, it is a circle. outer circle which is darker in nature, whereas the inner square it will be lighter in nature. So we should always see outer circle या inner circle, inner square. इसको हमें पहले देखना है. We need to see the inner square in respective to this outer circle. तो आप देखोगे तो inner square should be what? Inner should be lighter. It should be lighter. Yeah, the inner square should be lighter. Agar if it is lighter or if it is pure white, then we can use them because it is well maintained. Whereas if it is of same color or if it is darker, then we'll avoid it. Fine. And you found a vaccine. Okay. You found a vaccine which the vaccine color was like this. Okay. The vaccine was like this. Okay. But the vaccine has been expired. Will you use the vaccine now? Will you use the vaccine now? Because it is well maintained but just expired. Will you use the vaccine now? If it is expired vaccine with normal or stage 1 VVM, still we discard it. Okay, discard it. Fine. And if we want to use any vaccine which we opened, then we need to use them within a certain period of time. Okay, certain period of time, and it should be well maintained with the temperature. Okay, remember this thing. And whenever you open a vial like multi-purpose vial or multi-loading vial, like for example pentavalent vaccine, you should mention the date and the time of opening. Fine. Next, this policy is known as open vial policy. But this open vial policy will not followed for this measles, rubella and BCG vaccines. Once you open, it's broken. So you should use it. Fine. And there are few side effects following this administration of vaccinations. The side effects include paralysis in a case of OPV. Yeah, the vials which don't follow this are include this previously MMR, BCG and COVID-19. Previously there was this variant of J was there, but now it has been replaced. Fine. And what are the adverse events? What are the side effects? If you see about this OPV, then it can lead to this paralysis. Hepatitis B, it can lead to this anaphylactic shock. Pertussis can cause this persistent crying in the child, and hypoxic ischemic encephalopathy will be seen in a case of pertussis. Okay, pertussis will see this HHE, and toxic shock syndrome will be seen in a case of measles. And rotaviral vaccine will cause what? Rotaviral vaccine will cause intussusception as a complication. Yeah, intussusception as a complications. Whereas this influenza vaccine will cause Guillain-Barré syndrome as a complication or side effect. Then thrombocytopenia is caused by this MMR and hepatitis B. Okay, then about this part, which is this, then about this delayed immunization part, if you see, means if in a very rural part of India, okay, not in urban India, in very rural part of India, there are few people who will be living in the poverty, so that they won't carry their children for this regular vaccinations. Now, if they are bringing their child for first time, like after 1 year, like around 2 years, then you should not tell no, you shouldn't bring before, so we cannot vaccinate it. So there are few exceptions, or few vaccines can be given after certain ages. For example, like if it is BCG, then it can given up to 1 year. The same for Rota, pentavalent, IPV, fractional IPV, PCV, hepatitis B vaccine. So all of them, they can be given till 1 year of age. Whereas up to 5 years, the OPV, oral protein drops, MR vaccine and vitamin A drops, all of them can be given up to 5 years. Whereas till 7 years, we can give DPT. In pregnant females, we can give this TD. Okay, TD. Okay, TD. Fine. Next, the JE vaccine can be given up to 15 years. Okay, these are this elapsed vaccination. Means in question they will describe. There is this 13-month-old child present for immunization. Okay, which of the following vaccines he will give? Option A, BCG. Option B, PCV. Option C, pentavalent. Option D, OPV. What will be your answer? You will give the D. What it is this option D? Will give OPV. Will avoid all these things because it is 13 months, which is more than 1 year. Then we'll move on to our next part. Then about this part, which is known as health communication methods. In health communication methods, first is what? It is the focused group discussions. It is between the 6 to 12 members, and what they will do, from one person they will start with another person, and like this the talk will be keep on going on, and one person will be sitting and drawing like us. Okay, So drawing like this. So this is known as what? Sociogram. This is known as sociogram. This is known as sociogram. Next, if you see, there are two things: panel discussion and symposium. Okay. In the case of panel discussions, like our TV panel, okay, there is no set speech. There is no set speech, and anyone can interfere. Okay, that's what. There is no order. There is no order and no set speech. Whereas in symposium, there is a set speech and order will be followed. Order will be followed. Yeah. TD will be given in pregnancy. Yeah. Or we can also given as TDAP. Okay. That component as well. Order will be followed. That's it. Right. Next about this method, like showing how to prepare the ORS. It is what it is, the demonstration. It is a demonstration. Okay. Next, we have few more health communication methods. For example, you want to tell about the cancer prognosis to the patients. Then you need to set up this protocol, which is known as spikes protocol. You need to set up this based on this spikes protocol. Okay. Next, about this approach, which is known as gather approach, also known as previously known as cafeteria approach, which is used for this contraceptive usage counseling. It is known as contraceptive usage counseling. Next, this funnel graph, like for example, you are going for a village where most of this non-literate people will be there. They won't be literate. So for them to make them easily understandable, what you will do, you will make the pictures of this scenarios or pictures of these things, and you will arrange them in a sequential order in a cloth. So this is known as funnel graph. It is known as funnel graph. Yeah. Then about the next thing, it is the Suraksha clinic. If you see about the Suraksha clinic, the mainly they will ask you is about the quit. The patient is presented with urethral discharge. If there is any presence of urethral discharge, cervical discharge, and anorectal discharge, will give the first kit. So remember, how will you remember this kit? Remember it as great girls wear blue, red, yellow bags. So you can remember by this mnemonic as what is the first sequence? It is the great. Remember, it is the gray color kit. It is the first kit. It is a great girls. So green, okay, wear for white, then blue, red. So next one is the blue, then red, then yellow, then black. So these are the sequential lineage of these kits. Okay, just remember how sequentially it is placed. And then remember, what is the discharge? First, UV. So the first one, it is the urethral discharge. So for urethral discharge, you will give gray color. Okay, for urethral discharge or anorectal discharge, you will give this A color, which is the gray color one, the kit one. Then for vaginal discharge, you will use this green color kit. You will use this green color kit. Then for genito ulcer, okay, it is ulcer disease which is non-herpetic, means it is because of this bacteria and it's sensitive to penicillin. Where you will use what? You will use this white kit. Whereas if the bacteria, if the organism is non-sensitive to penicillin, then we'll use blue color. If there is any herpetic ulcer, okay, herpetic ulcer, we'll use this red color kit. Then about yellow, remember it is L-low, it is what it is, lower abdominal pain. L for lower abdominal pain will you be using the yellow kit, and black for bubo. Okay, this is the bubo. Okay, black will use this inguinal bubo. In the case of inguinal bubo, will use this black kits. Okay, just remember, and this is the logo of Suraksha clinic, which is this reproductive tract infections or sexually transmitted infections clinics. Okay, remember. Next about the triage. You know, this triage is based on this likelihood of survival and it done at the site of disaster. Okay, done at the site of disaster. So if you see red one, they are this highest priority ones. They are the highest priority ones. So they need this immediate resuscitations. If there is no immediate resuscitations, they will die. For example, in a case of pneumothorax, in a case of cardiac tamponade, they need this intervention within less than 6 hours. Okay, less than 6 hours. Next about yellow, they can wait. Okay, they can wait. Okay, they can delay it for few hours and who need a surgery within 6 to 24 hours. Next about green, they are this low priority. Who are telling like, sir, 2 दिन से बुखार है. Means 2 दिन से बुखार है बोल के they will come for this emergency. When they ask, like, yeah, literally the patients will come like this. Like it will be around 6 o'clock where your OPD will be closing and you will be sitting your casualty, putting the cannulas and things, and there will be like around this young males or young females, they will be coming at around 6 o'clock and they will ask you, they will tell you, क्या हुआ पूछोगे, means you will ask what happened. You will tell sir 2 दिन से बुखार है. Okay, so they will tell they have this fever, but they could have come to the OPD for a proper evaluations. But this type of ambulatory cases will come to this green thing. Okay, so this minor injuries, small crashes, small aberrations, it will come under this green one. Okay, then about this black one, that is this least priority are the dead or moribund patients. Okay, who is in this coma, who is dead, who is brain dead, they are classified as the black one. So remember, this triage will not have 3 colors. The name is triage, means to segregate. It will have 4 colors. Remember, it will have how many colors? It will have 4 colors. It will have 4 colors. Good. Fine. Next, we'll see about this biomedical waste management. Biomedical waste. Then about this yellow, remember, here, remember, these are this body secretions. Body secretions are in contact. Yeah, in contact. Remember, if you know Hindi, you just remember it is patti, plaster will be in pila. Okay, patti, plaster, and pila means if there is any soaked gauze pieces, if there is anything which is exposed to your body fluids, it should be thrown on into this pila, which is yellow. Okay, whatever the plaster it is, whatever the patti you have used it. Fine. So this cotton waste, this dressing materials, this body fluid and contaminated paper and cloth with it, and your face mask. Remember, your face masks and your cloth, and all of your cytotoxic drugs and the microbiological waste, all of them, they should be thrown into this yellow color bag. Whereas for this red, remember red for this recyclable one. Red rubber and recyclable. Remember. So here, what we'll use? We'll put mostly this rubber and recyclable plastics, which include this IV set, catheters, gloves, even gloves with pinch of blood. We'll put in the red only. Okay. They will ask you where you will place this blood bag. Your answer should be what? Your answer should be yellow. They will ask you once more where you will place this empty blood bag. What will be answered now? It should be yellow still. Okay, if the blood bag is empty or full, it will be what? It will be always discarded in the yellow. Fine, it will be always discarded in the yellow. That's why I asked you. Okay, if the blood bag is empty or full, that is no matter. It should be always discarded in this yellow bin. Fine. Whereas a red one, if it is new, plus new gloves also, or if it is soiled gloves, then also it will be put into this red one. Okay, and all this IV set, catheters, okay, urine analysis kit, urine bag, IV bottles, plastics and goggles, all of them should be thrown into this red one. Fine. फिर उसके बाद white. If you see on the road, who will be wearing this white, right? Like who will be wearing this white shirt? They'll be having this very brightness, very sharp. Okay, you can find them wherever they go. So likewise, remember this white, it will be for sharp. Okay, sharps for this white. For example, your scalpels, your blades, and your syringes with fixed needles and the rest of the needles. All of them should be thrown into the white. And remember, rest we can use bags. Whereas in a case of white, we need to use this cardboard boxes because it should be puncture proof to prevent this injury from this shot. Okay, it should be puncture proof. Fine. And next about blue. Remember blue for broken glass. Broken glass. So blue should be used for this glass and metallic implants. Glass and metallic implants. Okay, it is used for this glass and metallic implant. Okay, the blue one. Then this is how you will remember. So patti, pila, plaster, you will put in pila, means yellow, means whatever the contaminated with body fluids like blood and other like secretions from the wounds, it should be thrown into yellow. Whereas red one, recyclable plastics, your urinary catheter, your IV sets, your bottles, it should be thrown into red. Whereas white for your sharp needles and scalpels, it should be thrown into white. Whereas for blue, it should be the broken glass and this metallic implants. All of them, they should be thrown into blue dustbin. Fine. Then about how will you treat them before disposing? If you see about the yellow, these are the most of these anatomical waste. For them, what we'll do to prevent infection or spreading of the infections, we'll do incineration. Incineration, if there is any anatomical waste like our placenta, our amputated limbs. Whereas in a case of microbial and chemical waste like our radiological developmental films, will do deep burial. Okay. Then about this red one, we'll do autoclaving and microwaving, followed by this with shred and will recycle and use it. And blue, what we'll do, we'll do same autoclave in microwaving, then after that we'll shut them and we'll use in construction of rows, fine. And white will you need to landfill them or you need to put it in shop, okay. Mostly this is the thing which we use for this biomedical waste and how will be managed. A good actor prototype and Shanavas and Mona, fine. Next we'll move on to this graph, fine. About this graphs, if you see, you want to know how will you differentiate this histogram from this bar diagram, fine. If it is telling where you will discard this vaccine vials which is expert, then you should discard in the yellow one, okay. If it is just any vials they are the broken glass, they will be given in the blue one, fine. The first one, if you see, if it is touching together, like a hutch, so draw this hutch. If it is touching together, it is what it is, the histogram. It is the histogram, fine. Next, about you saw this histogram, and in histogram you see on center you draw some points and you are connecting them, so it is what it is known as frequency polygon. So you have this histogram in the back and you have this connecting dot, so it is what it is, this frequency polygon. And next, the same thing, you draw a curve in the center of a behind this or in front of this histogram, so it is what it is, this frequency curve. It is the frequency curve. And next, if you see this like kind of bars, but it is not this quantitative variables or it is not in the frequencies, so it is what it is, this bar diagram which is having this discrete variables, okay. This is the bar diagram, and there are different types of bar diagram. If it is having same bar diagram which is in two colors, it is the component bar diagram, and if it is two things together, like three things together or two things together, we'll call them as multiple bar diagram, okay. And next, to know this trend of these events, we'll use this, or trend of this disease, we'll use this thing which is known as line diagram, okay. Based on the trend it will change, okay. Based on the trend it will change, like this trend can go up and even go down, so that is the catch point. So this is in line diagram, this will go down, whereas give, remember it is give, अगर आप किसी को देते हो तो प्यार बढ़ते रहता है. So remember, if you start giving love to someone, then your love towards them or this love towards your subject will keep on increasing, ठीक है. जैसे आप पढ़ते रहते हो तो उसका means then you will get more eyes to read, right. The same thing in the case of give, it is the cumulative. See, remember it is 20 plus 40, so 20 plus 40 it will remain as 60, it won't come down to again 20. So then if there is 60 plus 2, it is 62, and 60 plus more 3, it is 65, it won't come to 20 or 40. So in the case of give, it won't be any negative value, so it is the cumulative frequency diagram. So if it is not coming down, it is the give. If it is having the dip, it is what it is, this line diagram which is showing the trends of events, fine. And next, about this scatter diagram. The scatter diagram will show like what is the relations. Is there any relation, like positive correlation, negative correlation, and no relation, okay. This is the scatter diagram. Next, you will see kind of pi, okay. Kind of pi, you have this 100%, and each of them they will have this individual specific values, and there is no overlapping. So it is what it is, this pie chart. It is the pie chart, fine. And next one, it is this stem and leaf plot. You want to separate them, so based on the stem and the leaf. So it is this stem and leaf plot, okay. Then about this plot, which is known as what? Then about this, pi is easy to identify, right? It is very easy, okay. Then it is what? This is the funnel plot, like funnel they are drawing, right? It is known as funnel plot, okay. It is known as funnel plot. And next, if you see, this is a box and whisker. This is the box and this is the two whisker. So it is known as box and whisker plot. Fine. And next, this is for this systemic analysis and meta-analysis. We'll use this type of plot which is known as forest plot. So remember, it is the forest plot and rest of the plots. For example, histogram, remember. Then if it is drawing lines, it is the frequency polygon. If we are drawing a curve, it is this frequency curve, followed by this bar diagram, and in line diagram we know it will be having this dip, whereas give, okay, if you started giving, you won't be having any fall, you will be in heights in your life. So that is this give, it is a cumulative frequency diagram. And next is this scatter diagram, and this is the pie chart, and this is how this sequential segregation, which is the stem and leaf plot, and this is how this funnel plot looks like. And finally, this is the box and whisker plot, and this is the what? This is this forest plot which is used in a case of meta-analysis. Okay, so these are the things you should know from this images. Fine. With this understanding, we'll move on to the next part. Next, we'll move on to this standard deviation. If you see about this standard deviation, the normal standard deviation curve, it will be this normal distribution curve, it will be this bell-shaped curve. It will be this bell-shaped curve. It is this bell-shaped curve. And once you see this bell-shaped curve, you will be able to see this type of standard deviations. There will be few standard deviations. If it is line at the center, if it is a line at the center which is having a symmetrical distribution, then the mean, median and mode, all of them, it will be what? It will be equal. Whereas if you see from the mean, if you take around this one standard deviation, so how much amount of variables or how much percentage of these things lies in? Okay, it is what it is. This 68% of these things will lie within this one standard deviation. Whereas within two standard deviation, it is 95%. Whereas within 3, it is 99%. Whereas for 100%, it is at the level of infinity. So remember, it is not 4 will see 100%, at infinity only will see the 100%. So always this gap will be maintained. Okay, remember, it is the gap will be maintained. Okay, fine. So 1, it is 65%, 2, 95, 3, 99%. Fine. And they will ask you this about this positive skew and negative skew. In the case of positive skew, which will be having the maximum value. So first you remember the middle unit, right? What unit, right, is the median. Mean, median, mode. Mean, median, mode. So see, this negative skew, also known as, this is skewing on the left side, so also known as left skew. Always on the, always look into the tail. This is the tail. So always look into the tail. So this is the left side. So this is the left skew. So remember, how will you, what is the main value or the chief value in the left skew? So make this L and convert it like this. So if you see, if you draw like this, so here the maximum value kya hai? It is the mode. It is the mode. Okay, so I told you mean, median, mode. So here the maximum value will be the mode part. Fine. Whereas here it will be what? It will be on this opposite side. Here the maximum value will be for this mean. So here the maximum value will be for this mean. So itna yaad rakho. Next we'll move on to this few programs. Fine. If you see about this national TB elimination program, we'll see few programs. One of them is NTEB. This what it is, this national TB elimination program. Okay, so this what it is, this logo which is TB Mukt Bharat, TB Harega or Desh Jitega. Okay, this is the logo of it. And in this you need to know our aim of this NTP is what? It is reducing the incidence of this TB by 80% and reducing the mortality by 90%. Then for diagnosing of this TB, we'll use multiple tests. So the initial modality of diagnosis kya hai? Like initially it is clinical along with this sputum smear and chest X-ray. Sputum smear और करेंगे और chest X-ray करेंगे along with this clinical history. फिर उसके बाद करेंगे कि culture. Then once we make a diagnosis of TB nowadays, then what we'll do? We'll do CBNAT. To CBNAT करेंगे, we'll able to see or we'll able to confirm the diagnosis. Along with this, we know that we can detect this rifampicin resistance. ये कौन सा rifampicin resistance करेगा? Which resistance we can find? We can find about this, rifampicin resistance. And we know the culturing of these organisms will culture in a case of LJ media. It will take more time. So we have new generations of media which is known as bactec media, but in which the time will be more. So initially what we'll do this CBNAT and we'll tell whether the bacteria is present or not. Then we'll go for this resistant testing and it will tell. Then about this culture, we'll use this LJ media and this automated liquid culture like bactec medias. Fine. And about this molecular analysis, we'll use the CBNAT, which is a PCR, and then we'll use this line probe assay for this resistant testing of other drugs. Okay, resistant testing of these other drugs. And we have this ICT enabled online service system, which is known as NICS. Okay, it is the NICS. It is the NICS. Okay, it is the NICS. It is the NICS. Whereas remember, it is NIS. What is NIS? Yeah, like in India, if you ask me, the first one you need to tell it is CBNAT, because we call in India we'll use only one thing which is known as CBNAT. Okay, we won't usually use a STUNAT. Okay, remember, because in NTP portal itself or in forms itself it will be written as CBNAT only. Okay, so don't confuse it. So NIST, remember it is NIST, it is the free UPT kits. So it is what it is, this free UPT kids. Fine. Next, this logo is asked in the recent NEET PG examination. Okay, so this is what, this is the lotus. This is the lotus and the hand holding it. So it is the leprosy program, National Leprosy Elimination Program. Fine. And don't confuse this NICSHI with 99 dots. So 99 dots we used to use previously, but now the main, like if they ask you online portal for this TB, it is what it is, NICSHI. You should remember only NICSHI. Okay, fine. Next, about this leprosy, we were using the drugs. Like now the government or this WHO recommends to use this 3-drug regimen or this uniform drug regimen, which includes dapsone, rifampicin and clofazimine. Whereas we have two types of leprosy. One is known as paucibacillary and multibacillary. Paucibacillary will use drugs like dapsone and rifampicin. Here will use clofazimine, and it is given for 6 months and it is given for 12 months. Okay, and it is given for 6 months and it is given for 12 months. Okay, just remember. And this classification is based on the skin lesions and the nerve involvement. The skin lesion should be 1 to 5, and if it is 1 or more, 1 lesion will consider as paucibacillary only. If it is more than 1, will consider it as multibacillary leprosy. ठीक है, बस इतना आपको याद रखना चाहिए. So multibacillary हमें 6 महीने तक, paucibacillary we need to give for 6 months, whereas multibacillary we need to give for 12 months. Okay, then we'll move on for this National Program for Control of Blindness. As I told you, this blindness program, the most common cause of blindness in elderly care, it is the cataract. Fine. And previously WHO used to tell, like, it is the blindness which is less than 3/60 in the better eye with better possible or this best possible correction. Okay, this is less than 3/60. Fine. And for this vision, we run this school vision program where we analyze this vision in this children's as well. Okay, usually we go 2 times for every 6 months. We do this vision analysis, and mostly initially it will be screened by this teachers only. Fine. Yeah, it will be, if there is if the visual activity is less than 6/9, then it is being referred to this PHC. It is refers to this PHC. Remember. Then this logo is also asked in this NEET PG. If you see, this is what this, she is the Janani. It's a Shishu. So this Janani Sisu Shuraksha Karikram means Janani also should be good and Shishu also should be good. So here, this for maternal there is a free transport, free drugs, free diagnosis, free delivery, blood transfusion is free, and surgery if like cesarean section. Okay, and diet for vaginal delivery for 3 days and cesarean section for 7 days. Whereas for newborn, what is the free? The same diagnosis, drugs, blood transfusion, and newborn care corner and newborn stabilization unit and special newborn units. They comes under this Janani Sisu Suraksha Karikram. This is the logo of Janani Sisu Suraksha Karikram. Remember, fine. Next one, it is the Navjit. It is a Navjit Sisu, which mainly aims in training this doctors, especially doctors and this people who are walking in closely to this labor wards. So in such scenarios, we need to resuscitate these children. So mainly this training program on newborn care and resuscitation for all this healthcare personnel. Okay, fine. Next, about ASHA will perform one thing which is known as home-based newborn care. What is this home-based newborn care? Means after delivery, the ASHA will go to their home to see their wellness and to check whether they are vaccinated and or not. Fine. So in the case of institutional delivery, the ASHA will go on day 3, 7 because they will release on the second day. So she will go on this 3, 7, 14, 21, 28, 42. It will be having 6 days. As home delivery, she will go on the first day also. Remember, first day also. Fine. And next one, which is this Rashtriya Bal. So Bal means children. So here it will measure for this 4 Ds in children, like which include diseases, deficiencies, and developmental delays or any congenital defects. Okay, they will ask you the congenital defect in a child. The congenital defect in a child between the age of 0 to 18 years is being monitored or is being taken care of by which of the following programs? It is what it is, this RBSK, Rashtriya Bal Swasthya Karikram. Then Rashtriya Kishore Swasthya Karikram, it is for this adolescents for their diseases. Okay, just remember. Right? Next, the drugs. Yesterday we saw about this malaria drugs. Today we'll have a glance on this TB drugs and this HIV drugs. If you see, for TB, we use this regimen, HRZD regimen, okay, but it can lead to some resistance. We call them monodrug resistance if it is resistant to any of these first line drugs like HRZD drugs, fine. Whereas this polyresistance means more than one first line anti-tuberculosis drugs are other than isoniazid and rifampicin, because this rifampicin resistance, it is itself is a separate entity. It is known as rifampicin resistance. Then multi-drug resistance means if there is a resistance to both isoniazid and rifampicin, then we call them as multi-drug resistance. It is two drug, but we call them as multi-drug resistance, fine. Then extensively drug resistance. This extensively drug resistance to any fluoroquinolones and resistant to this second line injectable drugs. Okay, previously we used to use this second line injectable drugs, which if they get resistance, we'll call them as extensively drug resistant TB, fine. And we use this drug regimens, which is this 4 months, which is 4 means 4 plus 2 months. So 2 months of initial phase, which is having this HRZT, and 4 months of HER, okay, HER and HERS, okay. So 2 months, initial 2 months for HERS, and for next 4 months for HRE, fine. And in pregnancy, we'll usually use 2 months of HRE and 7 months of HR in 9 months, fine. That's it. So this is the method of this TB treatment in usual conditions. Whereas in a case of resistance, then we can use this kanamycin, levofloxacin, fine, then ethonamide, okay, then pyranzapine, ethambutol, and isoniazid. So we can use all these drugs for 6 to 9 months, here for 18 months. Just remember. Okay, just see this table before your examination, because it is very rarely asked, but it can have this chance to be asked in your examination for sure. Then about HIV, see, remember, just remember this DTG or TLD. That is tenofovir, lamivudine, and dolutegravir. And this is the drug which you use for the HIV, and we'll use them irrespective of their CD4 count. CD4 count. So CD4 count is good, bad, better? No, we don't care. We'll use this thing irrespective of their CD4 count. Okay, itna yaad rakho. Next, if the child is more than 6 years, and in the case of pregnancy, we'll use zidovudine, then or abacavir, then lamivudine and dolutegravir. So what we'll do, we'll replace this D, and with this D, we'll use this dolutegravir. Then the rest 2 drugs, we'll use zidovudine or abacavir along with this lamivudine. Fine. Whereas in the case of neonates or child, we'll use zidovudine or abacavir along with lamivudine or lopinavir, or any of this lopinavir, fine, or raltegravir. So just remember these things. If you don't remember, just remember this TLD for usual things, and the same TLD will be used for this prophylaxis in the case of needle stick injuries, fine, needle stick injuries, fine. That's it. So we'll use the same TLD, fine, TLD. And for prevention of this maternal to child transmission, we'll use this drug which is known as nevirapine, we'll use this drug which is known as nevirapine, fine. And we'll look into this very important topic, which is the ASHA part. So this workers, you need to know about this, what are these qualifications, what are their functions in the society, okay, and on where they get their training, and for how many days, right, and for how many days. So it will be a bit volatile. PSM will be like this only. It will be very rough. It will be very difficult. But make sure you are doing it perfectly, because this notes, it will be carrying at least 20 to 25 questions. Okay, 20 to 25 questions in examinations where 1 mark play a bigger role. It is really very important. Okay, that's what I will tell you. Then about this ASHA worker. ASHA worker, it should be a female who is either married or divorced, mostly resident of the same village, could be from this 25 to 45 years old. And for population norms, it should be 2 per 1000 ASHA. But now it is the minimum, it is the 1 per 1000 ASHA. Okay, okay, that's remember. Then the education should be 10th pass, and who will give training? It is the Anganwadi worker and the ANM. Okay, so now the minimum quality or the minimum ASHA should be there. It is 1 per 1000 population. It is not 2 which was proposed on. Okay, so now we are having is 1 per 1000 population. Okay, and training will be given by the Anganwadi worker and ANM nurses at PHC level. Okay, yeah, and main thing is that they won't give vaccine. So what they can give? So they can give or create awareness on this health and social issues. They can counsel women for this reproductive and child health, and they can act as a depot holder for this iron and folic acid and this small contraceptives. Okay, contraceptives they can keep, and this ORS they can keep. and few drugs, few necessary drugs, okay, and other family planning methods. These are the things can Asha do, but she won't give vaccines. देखिए क्वेश्चन में यही पूछेंगे whether Asha can give vaccines. The answer is big no. ठीक है, फिर उसके बाद आगे बढ़ते हैं कि मल्टीपर्पज वर्कर. There are two multi-purpose worker. Multi-purpose worker male and multi-purpose worker female. Okay, multi-purpose worker male, he will be helping in all other like this outside works, like for example sanitation of the water and chlorination of the water. Whereas multi-purpose worker female, she will be helping in the inside, like the record books maintenance and about this preparation of the slides. Remember, and this is mainly for this malaria workers. And the population now it is 1 per 5,000 population. Okay, at the level of sub-centers. And education should be 12th pass and training will be for 12 months. Fine? Yeah. The spraying also will be helped by this MPW. Then village health guides, health guides, it will be population is 1 per 1,000, but there is no access. Then they need to have at least 6 pass to be done, and they are training for 3 months. And we know this die. Okay, they don't need any education, but they need a training for 1 month. Okay, the population, since they are at village level, like village health guide and the die, both of them they are at this village level, so they need a training of 1 month. Remember, and they will be around this population of 1 per 1,000. So village, imagine it is 1 per 1,000. Asha, it is also 1 per 1,000 population. Okay, whereas this multi-purpose worker, she will stay at the level of sub-center. You know, sub-center in a case of plains it is 5,000. Okay, इतना याद रखना. Then Anganwadi worker. We know this Anganwadi worker, they are based on this ICDS. They are based on this ICDS, and one Anganwadi worker. It is for 400 to 800 population, and their minimum education qualification is 10th pass. But if they pass for 12th, then it is better. Fine. And they will undergo 4 months of training. Imagine they undergo 4 months of training. They are the Anganwadi workers. That's why they can give vaccines. Okay, remember. Okay, they will clean Anganwadi shops and clean drinking water, and they will be helpful in immunizations with along with ANC. ANC क्या? Fine. They will do this growth monitoring with this few scales. Salter scale which is used to measure the weight. Salter scale for measurement of weight. Then this Shaki step is used for which of the following guys? Yeah, heart. Means they are this Anganwadi workers, they are the heart of ICDs. Yeah. Shaki step, it is used for which of the following guys? It is used for measurement of, it is what it is, this mid-arm circumference. Then they also record this growth and development. Then about this most important program, okay? If you should read this program and you should go to the examination. Okay, make sure you are reading and going. Fine. This anemia Mukt program, it will be having this strategy which is known as 6x6x6 strategy. And main thing is that it will be having this 6 beneficiaries, 6 interventions, and 6 institutional mechanisms. And their aim is to reduce this prevalence of anemia by 3%. By reduce this prevalence of anemia by how many percent? It is not again 6%, it is 3%. It is 3%. It is a 3% reduction in the prevalence of anemia. Okay, and they will use 6x6x6 strategies. 6 institutional mechanisms, 6 interventions, and 6 beneficiaries. Who are the 6 beneficiaries? If you see the first one, it is what? It is 6 to 59 months old. They are what? They are this infants. They are this people like from this infant age. Fine. They will be given bi-weekly of around 20 milligram of iron along with 100 folic acid. So 20 plus 100. Okay, 100 mcg of folic acid. Fine. Next one, it is around 5 to 10 years of their children. So this 5 to 10 years of the children, remember, this children's which will mainly grown by this mother. So this mother, what will do? Means the mother need to give the tablets, right? So what is the color we'll use? So what is the best color? Are this the favorite color of the girls or this mother? It is what? It is the pink. So this pink color tablet will be given for this children. Will be given for this 5 to 10 years old children. Yeah, pink. Yeah, that's why initially we'll give 5 to 10 years. We'll give this pink color tablets to these children. Okay. Once they grow, they'll become boys and girls. Once they grow, they will become boys and girls. Okay. Here the dosage is here 2000. Here it is 45 plus 400. It is 45 400. It is 45 400. And after it is everywhere it is same. It is 60 plus 500. It is 60 plus 500. It is 60 plus 500. Okay. Yeah. Then the peoples will grow. Then boys will grow. Girl also will grow, right? So boys will pick their color. What is the favorite color of boys? It is what? It is the blue color. So this 10 to 19-year boys or this adolescents, they will be having this blue color tablet. They will be having this blue color tablets. Yeah, Neela, blue color tablets. Then followed by which the pregnant, means the pregnant who is under this, who is pregnant, and all these females who are under this reproductive age, they will take this red color tablet. Okay, red color tablet, lal. Okay, they will take this lal tablets, red color tablets. Okay, which will be having this 60 mg of elemental iron and 500 mcg of folic acid. Okay, right. So initially for syrup we won't have a color, right? Syrup, whatever color the child will drink, whereas girls are more specific with their colors. So initially तो बच्चों को भी वही पहनाएंगे. So initially they will be having this pink color between the age of 5 to 10 years. फिर 10 साल के बाद बच्चे को अम्मा बस काफी है, फिर उसके बाद मुझे तो blue color पहना. So they will use this blue color tablets with the concentration of 60 to 500, like 60 mg of iron and 500 mcg of folic acid. And this next one, this reproductive age females, and along with this pregnant and lactating females, they will use this red color tablets. They will use this red color tablets with 60 milligram of iron and 500 microgram of mcg of folic acid. ठीक है, बस इतना याद रखो. Next about this rabies immunization. Okay, we are about to see. Okay, we are about to conclude this PSM part. See about this rabies immunization. Remember, first you need to know what are the different types of rabies immunization. Like, let's see, you are a means no, not you are a doctor obviously. Means you have a pet, or your friend or your sister is a veterinary clinician. So they have this highest risk of exposing to this rabies. So they will be doing this pre-exposure vaccination. So remember this pre में कितना अल्फाबेट है? 3 अल्फाबेट है. सो प्री में 3 डोसेस होगा. सो 0, 7, 21 और इधर 28. ठीक है. सो प्री में 3 अल्फाबेट है. सो इट इज 3. सो रिमेंबर इट इज द 3 डोसेस and 3 visits. So 0, 7, 20, 28, and both we can use this intradermal route, which is this 0.1 ml intradermal or 0.5 IM. Okay, बस दोनों कर सकते हैं. ठीक है. And as they are told, they are at the risk. वो तो veterinarian है. ठीक है. And if you have कुत्ता, means if you have dog in your home, obviously वो मतलब whether it will bark or not, someday it will bite. इतना तो कोई ना कोई तो करेगा. Means कुछ ना कुछ तो करेगा. तो someday or other day, whether this dog will bark or not, it will bite for one day. So after this one, you already exposed this pre-exposure vaccine. Now you need to go for re-exposure vaccine. So in the case of pre-exposure vaccine, remember it is re मतलब it's में 2 alphabet. So you will be having the 2 doses. It will be having this 2 doses and 2 visits. 2 doses, 2 visits, the same, intradermal or intramuscular. But you are not like this. Means you don't have a kutta, means you don't have a dog or cat, okay, or something, any pets. Now you are just walking in your road, you passed your FMG, you are just enjoying your time, you are just going to your hospital, and some other day, means like or your friend is going, okay, imagine your friend is going and he got means bitten by this dog, okay, but he doesn't had any previous exposure. So then we'll use this 2 regimens. Now we usually use this updated Thai regimen, where we'll give 4 doses on 0, 3rd, 7 and 28. Previously we used this SN regime, which is an IM regime, which we use to give 5 doses and 5 visits. But here it is just 4 doses. It is this 4 doses only, 4 visits, and along with this, each time you will put 2 doses, like 2 doses, okay, 2 doses. So it is 8 doses and 4 visits, and it is the intradermal. So remember, Thai to thoda aram se, like, so it is what is intradermal, just 0.1, just for 4 days. It is what 4 days or 4 visits with 8 doses. So 0, 3, 7 and 28. So remember it is this post exposure. So remember post में कितना 1, 2, 3, 4. So 4 alphabets. इतना याद रखो. और SN में 5. SN में E for 5th alphabet, E for 5. इतना याद रखो. Next, you saw this post exposure. You saw this now the patient who is coming after this post exposure, but you should decide whether you need to give immunoglobulin or not. For example, there is category 1, like first you need to see and categorize the injury. Obviously you need to give this vaccine, but you need to give immunoglobulin or not, it is based on the category of the wound. For example, category 1, it is just licking or touching of this of these animals. Like for example, they are just licking your skin, okay, it is categorized as category 1 and it is none. We don't give any immunoglobulins in this case. Whereas in Category 2, it is what? It is just minor scratches but not yet bleeding. So for this minor scratches which is not yet bleeding, what we'll do? We'll do just use some of this vaccination and just local treatment. Whereas in a case of category 3, where you will able to see this bleeding, thing, there you will give what? You will administer this rabies immunoglobulin. There you will administer this rabies immunoglobulin. This rabies immunoglobulin, it is of two types, the equine one and the human one. So human one, it is given at the ratio of 20 international units per kg, whereas equine one, it is given at the ratio of 40 international units per kg. Right? So this is what? This is the rabies immunoglobulin. Okay, and there are few things you need to remember. If someone took rabies immunoglobulin previously, then they no need to take again. They don't need to take again in their life. And maximum of this immunoglobulin, it will be infiltrated around the wound. Okay, and remember one more thing, all of this rabies immunization, previously this IM immunization, it should not be done at gluteal region, it should be done at the deltoid region. Remember, it should be done at the deltoid region. Yeah, that's it. Category 3, what we'll do? We'll do immunoglobulin plus vaccine. Whereas category 2, it is just the vaccine. Category 1, kuch nahi karna, bas घर जाओ मोज रहो. ठीक है? Then we'll see about this tetanus immunization. Tetanus mein there are two things. There is clean wound or unclean wound. Clean wound matlab if it is less than 6 hours, we will call them as clean wound. If it is more than 6 hours or tidy wound, we'll call them as unclean wounds. Fine. So if a patient who is completed his immunization just within 5 years, फिर उनका कुछ नहीं करेंगे. If it is clean, unclean wound, ठीक है कोई ना, चले जाओ. If it is the patient which is under category B, he's completely immunized, but immunized within the gap of 5 to 10 years. ठीक है, 5 से 10 साल के बीच में कभी भी हो, then we need to give just one dose. Whereas if it is completely immunized more than 10 years, we need to give, if it is clean, then we need to give just one dose only. Whereas if it is an unclean wound, तब हमें tetanus immunoglobulin भी देना है. Fine. Then whereas in a case of, they don't know, like if you asked him when you have been vaccinated previously for tetanus, they don't know, I don't know. Then in such cases, you need to give 2 doses of this TT for this clean wound, whereas for unclean wound, you need to give complete course, which is this 2 doses along with this tetanus immunoglobulin. Fine. This is the most things, and we'll look into this few exercise topics. Fine. If you see, this is this rule of half for the hypertension. Okay, there will be this 100% population, out of which 50%, they know, like they are having, out of which 50% they will be having this hypertension. Or how many of them 50% will be having hypertension? This 50% will be diagnosed with hypertension, and those who diagnosed with hypertension, 50% of them they will be taking treatment. Okay, and 50% of them who is taking treatment, they will be having this adequacy of treatment. So it is known as rule of 50, which is used in a case of hypertension. We'll see in a case of hypertension. And you measure the blood BP of a child who is 90-60, and the child is grown now, and like at 10 years, or and now the child is 20 years. The BP is still 110/60. So there is a phenomena which is known as tracking phenomena. Means this BP follows a tracking phenomena. If the BP is low in their childhood, it will remain lower in their life long time. So this is known as tracking phenomena. Yeah, it is known as tracking of BP. Then if it is higher in this initial days or initial years, then it will be obviously at the end also it will be higher. Bas itna yaad rakhna. Then about this test, there are 2 tests. One is this qualitative test and this quantitative test. Agar qualitative test mein, if you want to compare between more than 2 groups, or if you want to compare 2 groups or more, we'll use this test which is known as T-square test. Okay. Then if you use this quantitative test, like they'll be mentioning here, they will mention about this percentage or proportion. If they mention in question about this mean or standard deviation, there will be 3 scenarios. Fine. Remember, there will be 3 scenarios. If it is within 1 group, if it is between 2 group, if it is more than 2 group. Okay, remember. So remember, if your friend is single, okay, okay, you will make them committed. Okay, if it is only 1 group, you make them committed. So it is known as paired t-test. Okay, paired t-test. If you are single and if your friend is mingled, then you separate them. So if it is two groups is there, if they are paired, means 2 is there, then you unpair them. Then it is known as what? It is known as unpaired t-test. Okay, unpaired t-test. And if it is more than 2 groups, it is known as ANOVA test. It is known as ANOVA test. Okay, it is known as ANOVA test. Bas itna yaad rakho. Then about this factory sack. Based on this factory sack, the maximum recovers it is 48 hours per week. Fine. And if including overtime, it should be within 60 hours, and minimum space in a factory for a person it is 500 cubic feet. Then this is the logo of ESIC. This is the logo of ESIC. And we know ESIC, there will be few benefits will be there. Okay, the employee and the employer. The employer pays higher, which around 3.25% of this amount, whereas here he will pay 0.75%. Fine. And this benefits include this sickness benefit. In sickness benefit, there he will get 70% of the salary for 91 days. Whereas for this extended sickness benefit, for 2 years he will get 80% of the salary. Okay, for this 2 years, for this 80% of the salaries. Fine, remember. Next for enhanced, remember enhanced matlab you are keeping hands and you are doing some surgery. For example, you are doing tubectomy and vasectomy. For tubectomy, it is for 14 days. For vasectomy, it is for 7 days. For tubectomy, it is for 14 days and vasectomy, it is for 7 days. Fine. And next about this thing, this disease, impairment, disability and handicap. Okay, disease means, for example, a man is undergoing RTA. RTA, it is a disease, and he lost his limb. And because of this loss his limb, he is unable to walk. So he is unable to walk, he is unable to do his work as a driver. Okay, so it is DIDH. So disease, impairment, disability and handicap. So they will ask you, the patient is unable to walk after an RTE. So this is an example of disease, impairment, disability. You should tell he is unable to walk, he is unable to perform his daily activities. It is known as disability. Okay, disability. And he is unable to perform any social tasks, then we'll call it as handicap. Remember, okay, this is the main difference that you should know. Then about this one, single exposure points of epidemic. If you see all of these cases within this one incubation period, and there is a sudden rise and sudden fall. Like example, the Pani Puri wala. Okay, if there is any food poisoning, it will be having this single exposure points of epidemic, and all of the cases will rise rapidly and fall rapidly. Okay, all of them they will rise rapidly and fall rapidly. This is the case of single exposure points of epidemic. Example is staph aureus poisoning. Okay, and next if you are able to see, there is this multiple peaks. The multiple peaks, but their common source is there. So it is known as multiple exposure point source epidemic. For example, the well contaminated, well and contaminated wells with typhoid bacillus. Remember, fine. Are this milkman carrying this contaminated milks? Fine. And next one, if few diseases are there, it is being spread, and this disease will cause spread to others and to others. So it is known as propagated epidemic. The example of this propagated epidemic is it is the TB and our hepatitis A. Next, we need to remember about this data. The current infant mortality rate is 28, whereas current neonatal mortality rate is 20, under 5 mortality rate is 32, and maternal mortality rate is 97, perinatal mortality rate is 18, and sex ratio of current is around 943. It is 943. And see, this most of this to identify whether is there any social problem, we'll use this infant mortality rate, and whether the females are having the maternal health properly will be assessed by this maternal mortality rate. Okay, so the health status of the community will be mainly measured by this infant mortality rate. To remember this ratio, try to remember in the ratio of, just try to write them in this sticky notes and keep pasted to them. Okay, it will be remembered. Okay, don't worry. Then about these diseases, just if you are able to see this flower on the hand side, is this non-communicable diseases program. And for this iron deficiency program, okay, this is the logo of this sun. Okay, and you need to know at production level it is 30 ppm, or at consumer level it is 50 ppm. Okay, and this is this Suraksha Smatriva Abhiyan, where he will conduct this on 9th of every month for this obstetrics checkup. In this IDSP, the 3 people, SPL people, where this 3 forms will be there, S form, P form, L form, where it will be given by this health worker, the next one by this U, and third one by this lab confirmed diagnosis. Fine. Then Ujala, remember it is Ujala, it is the brightness. So Ujala, it is the LEDs. Next, this Ujvala, it is what? It is the gas cylinders. And next one, if you see this Ujavla, it is what? It is the child trafficking. Fine. And next one, this is this Mission Indrajanus, mainly for this 7 vaccine preventable diseases. Okay, it is for the 7 vaccine preventable diseases. Fine. And next, this is this Pradhan Mantri Jan Arogya Yojana. Here you will get 5 lakhs. There will be 5 leaves, so you will get 5 lakhs of your insurance, and it is not depend on your number of family members. बस इतना याद रखो, ठीक है? And Pradhan Mantri Matru Vandana Yojana. Okay, it is for this cash incentives. Okay, they will give this incentives during deliveries. Fine. And this is this RKSK, and here the both boys and girls of this adolescent age, they will be engaged, and they will be approached under this approach, which is known as Satya approach. Okay, Satya approach. And this is this Poshan Abhiyan, which will give this nutrition of half of their protein requirement and 1/3 of your daily calorie requirement. Okay, as I told you, this is this leprosy logo. Then Lakshya, it is for this improving this labor room quality. It is to improve this labor room quality. And this is this Food Safety and Standards Authority of India logo. And next one, it is this AGMARK, which is given for this few food items. Fine. That's it, guys. That's it for this PSM part.